Hello everyone, I'm Dr. Jerryl Banait, consultant dermatologist practicing in Nagpur, Mumbai and Pune. I'm talking to you through DermaVidya, an access to dermatology world. Today we'll be talking about vitiligo and phototherapy. Vitiligo is a skin condition which affects individuals globally. It is not just a condition which affects the skin, but also the mental psyche and the psychological aspects of an individual. We'll be talking about the causes, types, how we can cure or treat vitiligo, and also about phototherapy. Vitiligo is an acquired, polygenic, multifactorial pigmentary disorder of the skin and mucosa, which shows characteristics of loss of melanocytes and sharply demarcated white macules. It is due to destruction, degeneration, and reduction of melanocytes in the affected areas. Vitiligo is an autoimmune destruction of melanocytes. It has multifactorial reasons to it, which can be genetic or non-genetic. Usually, generalized vitiligo has a family tendency of vitiligo and also autoimmune conditions. It can be classified into segmental, non-segmental, mixed type or unclassified. It has other subclassification like focal, mucosal, lip tip variation or generalized variations and many more subclassifications. Vitiligo is a non-communicable condition, but unfortunately, the societal pressure and the restriction causes more psychological distress on the patient. The patient is more traumatized due to the societal pressure than the skin condition itself. Phototherapy refers to the treatment with ultraviolet radiations. It ranges from 270 nanometer to 320 nanometers. There are two types of radiations. One is broad spectrum and one is narrow band spectrum. There is also excimer, which works on 308 nanometer, which is targeted at a smaller patches of vitiligo. Phototherapy targets on stabilizing the depigmented areas and stimulating the residual melanocytes. Narrowband ultraviolet radiation is considered as gold standard treatment for vitiligo and phototherapy. Around 50 to 75% of patients get good results with this therapy. The treatment usually is given 1 to 2 sessions per week and can continue up to 3 to 6 months. Usually the results are good and desirable after 3 to 6 months of therapy, and the best results are seen after 1 to 2 years of continuous therapy. Narrowband therapy is considered as a gold standard for phototherapy in vitiligo. About 50 to 75% of patients find good results and repigmentation on the areas like face and neck. Hands and feet are less responsive. But the sessions which need to be given to the patient are 1 to 2 sessions in a week, which will last for several months together. Desirable results are usually procured in 3 to 6 months of therapy, but the best results can be procured in 1 to 2 years of continuous treatment. The affected areas of vitiligo patients are exposed to UV lights. It might be an excimer or a UV booth. Usually the sessions start with a few seconds to a few minutes, which is gradually increased as the patient's skin becomes accustomed to these lights. A session can last from a few minutes to 30 minutes. And the patient has to be monitored continuously to check any adverse reactions on the skin by the UV radiations. Phototherapy is usually considered very safe treatment, but there can be some short-term or long-term effects. In short-term effects, there can be erythema, there can be itching, there can be burning sensation, or some tanning on the unaffected regions. In long-term, there can be hyperpigmentation on the unaffected skin, or it can even lead to increased chances of cancer. For safety considerations, one need to do regular visits, regular checkups, and also dose control. During the procedure, one needs to protect the skin, one needs to protect the eyes. Also, we should avoid using photosensitizers. For long-term care, one should also combine the therapies like oral therapies and topical therapies, and can also shift to alternate treatments rather than just focusing on phototherapy. Combination therapy which can be given are topical corticosteroids, oral calcineurin inhibitors like tacrolimus, vitamin D analogs like calcipetrol, oral and topical antioxidants, eczema therapy, and oral psoralen also. Key lifestyle changes which are required are to wear sunscreen with a sun protection factor of 30 and above. Also wear protective and full length clothing. A balanced and nutritive diet is also very essential, which is full of antioxidants, vitamin B12, vitamin E, zinc, because studies suggest that it helps in a good skin and also in pigmentation. One also has to concentrate to have a stress management and a stress-free life, because stress can also exacerbate vitiligo in certain cases. Patient also needs to avoid triggers like chemical injuries or even infections. Patient also need to visit their dermatologist regularly. JAK inhibitors, targeted therapy like eczema, systemic immunomodulators and gene therapy, melanocyte transfers, vitamin D analogs. There are n number of newer technologies and newer formulations in topical applications as well. I hope I have been able to give you a brief overview about vitiligo and phototherapy. For many such videos, do subscribe to DermaVidya.com. For any skin or health related conditions, kindly consult a qualified dermatologist near you. Thank you.
For more such videos, visit or log into dermavidya.com.